We're going to be talking about carpal tunnel syndrome, and here joining us is Dr. Keith Santiago, hand and upper extremity surgeon from Low Country Orthopaedics. Dr. Santiago, thanks for joining us today.
Thank you.
Can you tell us what is carpal tunnel syndrome?
Carpal tunnel syndrome refers to a nerve that starts out in your spinal cord of your neck and travels into your fingertips. At the level of the wrist, the nerve is compressed by a thick ligament that puts pressure on the nerve. It's similar to someone taking their foot and stepping on a garden hose, preventing water from watering the plants of the garden. Similar to plants without water, if the pressure is large enough, it ends up causing numbness in the fingertips and also pain as well.
So is it true that you can actually get carpal tunnel syndrome from typing or using your BlackBerry too much?
So there are many different causes for carpal tunnel syndrome. There has never been any proven relationship between repetitive activities such as typing or using your BlackBerry and carpal tunnel syndrome. It's not really sure why one person develops carpal tunnel syndrome and why another person does not.
Okay, and once you diagnose carpal tunnel syndrome, what are some of the treatment options?
The treatment option that I recommend is surgical correction of the condition, which is a thickened ligament, and that involves release of the thickened ligament. But if individuals do not want surgery, there are other options available, such as anti-inflammatory medications, corticosteroid injections, and a wrist brace that they wear particularly at night.
Okay, so if someone does opt for a surgical procedure, can you tell us what rehab is like?
Yes, so the surgery itself is done as an outpatient basis. It takes about a half an hour. The anesthesiologist gives the individual a cocktail of good sleeping medicine, and I give them some numbing medicine that makes them comfortable so that they have experience no pain during the surgery. After their ligament is released, they're put in a soft dressing that they keep on for 4 to 5 days that allows them to move their fingertips right away to prevent any stiffness. After 4 to 5 days, they take the soft dressing off and they keep their incision covered with a Band-Aid. I encourage them to start moving their wrist. At 2 weeks, their stitches come out, and at 1 month, they have no restrictions.
Great. Well, Dr. Santiago, thanks for sharing that with us. For more information, you can contact Dr. Santiago at Low Country Orthopaedics at 797-5050 or log on to lowcountryortho.com.